welcome. So we are going to do this case study. So start the image below and answer the subsequent questions. So 1, name the instruments 1 and 2. So this is our instrument 1, this is our instrument 2. Then name 2 procedures that you would use for each of the instruments 1 and 2. Then 3, what complications can be associated with inappropriate use of instruments 1 and 2. So this is question 3. The name N1, so just one precondition for use of the N1 of the 2 instruments. So question 1 is saying name the instruments 1 and 2. So instrument 1, this is a Sims speculum. So this is a Sims speculum. So Sims speculum. Then this is a Cusco. Okay, so that's a Cusco. So instrument 2 is a Cusco, so let me just put a C. So instrument 2 is a Cusco's speculum. The name 2 procedures you would use for each instruments 1 and 2. So instrument 1, which is a Sims speculum, for number 1 indication, you can say it can be used in inspection of the cervix and vagina to detect any injury following deliveries. So you can do that. Then Sims speculum also can be used for dilatation and evacuation. So that's 2 indications. So inspection of cervix to detect any injuries and following delivery and dilatation and evacuation. So we're done with instrument 1. Then instrument 2, which is a Cusco's speculum. So indication 1, it can be used to visualize the cervix and the vaginal fornices for any local causes. So any local causes meaning polyps, ectopy, meaning of those local causes of APH, can visualize this too. Can use the Cusco speculum to visualize the cervix and vagina. And then indication 2, it can also be used. So this same Cusco speculum can also be used to detect leakage of liquor from the cervical os in a case of suspected premature rupture of membrane. So since your digital electroexamination is not indicated, so you can just use a Cusco to visualize the cervical os in prom, in suspected prom, so to speak. So that's the procedures. Then complications. What complications can be associated with inappropriate use of instruments 1 and 2? So for the inappropriate use of this, you can cause vaginal tears. That's the most common cause. Vaginal lacerations, cervical tears, cervical lacerations. So those are actually 4 I've mentioned. So vaginal cervix, cervical tears, cervical lacerations, vaginal lacerations, vaginal tears, perianal tears. So those ones, those are some of the complications with inappropriate use. Then when one precondition for the use of this, so of the 2 instruments. So before we start to use those two instruments, so you need to make sure that they are sterile. So the one precondition for use of these 2 instruments is that they have to be sterile. That's one of the precondition. Alright, thank you. We are done with the case study. Make sure to subscribe and see you in the next case study.